Vyvanse activates the brain and body's nervous system and is shown to be effective in treating attention deficit hyperactivity disorder and binge eating disorder. All stimulants probably help with this type of eating disorder, but Vyvanse has been approved by the Food and Drug Administration for this condition. Dosing of Vyvanse typically starts at 30 milligrams and a maximum of 70 milligrams a day. Probably works in a similar fashion to Adderall and other stimulants, although it's not exactly sure how it works. And just like the other stimulants, it can have several possible side effects, including getting dependent on it, dependency, risk of abuse. So it needs to be taken as prescribed. It's good to take days off of the medication so one's body and mind does not get too dependent on it. And if it's lost or stolen, the police should be notified. A police report should be filed, and there's really no guarantees an early prescription will be provided. Stimulants in general, they can have some serious side effects. They can cause heart attacks, strokes, aggressive behavior, psychosis. But more commonly, stimulants are associated with milder symptoms such as increased blood pressure, anxiety, irritability. But because it affects the brain and nervous system, there can be an extensive list of possible side effects. So it's important to be aware of these and use this types of medication with caution. The medication sometimes needs an authorization from insurance, so it may not be the first go-to because it could be expensive. It is an option for attention deficit hyperactivity disorder and binge eating disorder that has been helpful for many people.